People always ask me what medical doctor I go to because they know my stance on medicine, and they know that, you know, I'm not the first person to say, hey, give me a drug. So people ask me constantly, what medical doctor do I go to? How do I go to doctors? Who is my doctor? And this and that. Okay. So that's a great question. Here's what I do for when I'm sick, when I have an ailment. I'm actually on my way right now to see a healthcare professional. It was perfect timing for this video. So what I do is, nothing serious, by the way. What I do is, I have a standard medical doctor that I go to. And the medical doctor that I go to is extremely flexible with me, because a lot of medical doctors aren't. They say, this is your condition and this is what you have to do, and here's the medication, and if you're not going to do it, you can't be one of my patients. Okay? I don't have a doctor like that. I have a doctor that says, you know, he says, I know you've done research, I know you're smart, this is what you need to do, this is what I suggest, or just handle it however you want. Or sometimes he goes, no, this is much more serious, and you really need to do this. Now, he says he knows natural therapies. He says he has a lot of experience. And the funny thing is, he worked for Dr. Schrachter. Dr. Schrachter is the guy who used to be the president of the Drugless Practitioner Society. So he has experience working with Michael Schrachter. So it's very exciting. But he doesn't really practice that with many patients whatsoever. So with me, he's much more lenient than he is with his other patients. And the reason why he's much more lenient with me is because I speak up. It's your right when you go to a doctor to tell him, say, hey, that's something I don't want to do. I don't want to do that. What other options do I have? I don't want to take this drug. Is there a less of a drug? Is there diet? Is there lifestyle? Is there something else that I can do? Is there an herb? Is there a supplement? Is it something that, you have that right to ask your doctor. Now, if your doctor doesn't know that, then I'd find a new doctor. It's plain and simple. Find a new doctor, because he's not willing to look outside of the other possibilities of the other treatments. And, it's a shame. It's terrible. So I go to my doctor, and I'm not happy with what he says all the time. Sometimes he'll write me a prescription. He'll go, oh, this is so serious. He's the kind of guy, oh, this is super serious. This is super serious. And I'm like, okay, that's fine. I know it's serious, whatever. And just because that's the kind of guy he is, but I'll take the prescription. I may never fill the prescription, by the way. A lot of times I don't. Because what I do is then I go to my kinesiologist. I go to a chiropractor that's trained in kinesiology. That's where they test your muscles. And I've had some amazing results going to this doctor, Doc Rick Hunton in Newburgh, New York. Fantastic results. One time I went to a regular chiropractor, and I went to my doctor because I couldn't walk. I was keeled over and I couldn't walk. And nobody had an answer for me. The first chiropractor I went to was just, doing regular chiropractic stuff on me. The doctor I went to was like, well, let's order an x-ray. Let's do this. Let's do that. Of course, I couldn't find anything. I went to Doc Rick, chiropractic kinesiologist. He starts doing the muscle testing where you put up your arm, and he tests you with different things, vials in your hand. And after a couple minutes, he goes, what are you eating? Let's talk about your diet. And I was going through my diet, and he goes, as I'm on my diet, he's putting things in my hand, and all of a sudden my hand just falls way down from the muscle test. And he goes, what are you doing with celery? And I said, well, I'm juicing 2 heads of celery a day. He goes, stop it immediately. He goes, and he explained, he got really technical with me. Basically, I wasn't able to process or digest enough of the celery juice that quick enough, and it was blocking something, or it caused a temporary obstruction, not the juice itself, but something had swollen inside me, inflamed. It was causing something else, and it was a chain reaction. Within hours, I was walking it. Now, mind you, I could not walk, and it happened like that. It was a Saturday afternoon. I was in my restaurant. This was years ago. I was cooking. This was when I used to cook every meal. I was in the restaurant cooking, and it was 11:30, and I was fine. I was there for an hour. I was picking up boxes, accepting deliveries, running around. 11:30, I said, I got a little pain in my back. By 12:30, I couldn't walk. That's how fast it got me, just like that. And I was on the stairwell, and I had another friend who was a chiropractor who started working on me. Monday I went back to him. He did more work on me. Went to my doctor, and it was just so frustrating because I wasn't getting an answer. And it was to the point where I couldn't walk and couldn't drive. I remember crawling around my house. It was terrible. It was pathetic. I was in so much pain. So I was crawling around the house. Else I would have drove to him. So somebody actually drove me to him. I think my mom actually drove me. And he went through to this muscle testing. I got to tell you, he adjusted my body, worked on things, made some adjustments. Within a couple hours, I was up and walking again. I'd stopped the celery juice immediately. So it's not that the celery juice wasn't healthy. It was just causing some kind of reaction in my body that my body couldn't handle at the time. He told me to basically don't consume that much celery. I can have celery in moderation, but don't juice 2 heads of celery a day. So I've told several medical doctors this story, because medical doctors don't typically believe in kinesiology. They don't believe in muscle testing. The thing with muscle testing is your muscles don't lie. When you hold something in your hand or you're around something that makes your body weak, it's impossible for you to hold your muscles strong. So that's in a sense a rundown of what muscle testing is. So many doctors do not believe this. So I've told this story over the years to many handfuls of medical doctors, and they're just like in amazement. They're like, well, what is kinesiology? What is it? This and that, and muscle testing. What do you mean? When you first explain it to them, they don't believe it. After I tell them my personal experience with it, they're literally like, wow, and amazed. Now you'd think that a doctor would follow up and get more about it, but of course that's typically not what happens in the medical world. When I got healthy in Colorado when I was 28 years old and I dropped every medication, the first thing my doctor says is to me, I don't know what you did, but whatever you did, I couldn't have given you medication that would have performed better than what you did. But the funny thing was, he never asked me what exactly I did. That was never a comment, never a question out of his mouth like, well, Marcus, what exactly did you do to drop your cholesterol 75 points? What did you do to get rid of asthma of 28 years? What did you do to get off all these medications? What did you do so you can just sleep normal at night and not have acid reflux so bad you don't need medication? But it wasn't even a thought process out of the doctor's mouth or mind. So I go to a doctor, my regular medical doctor, I get his opinion. I'll get orthodox testing like blood testing. I'll take standard blood tests. I'll do standard tests like that. I take all that information. Then I go to my kinesiologist. I get muscle testing done, and I go through a full workup with my kinesiologist. And then, now I'm presented 2 sides to the story. I have 2 stories on hand. I have 2 situations, same ailment, same conditions, but I have 2 separate ways of looking at it. From there, it's my choice what I'd like to do. And I think this is the most important thing when patients, you as a patient, you go to a doctor, it's your body, it's your choice. It's not your doctor's choice. You look at a doctor as basically just giving you mere suggestions of how to treat something. But it's like buying a car. Why would you buy a car from somebody who says, because you have to buy this car, and this car is, no, you buy a car because you want the certain features. Well, you go to a doctor because you want certain thought process, you want certain ideals, you want certain options. You don't go to a car lot and buy the first car they show you, because you want to know what else you can drive. You want to know how fast it can go. You want to know if there's the air conditioning. You want to know if it's a comfortable fit. Same thing with your doctor. You shouldn't settle for just any old doctor, and you shouldn't settle for what the doctor tells you. You should always push your doctor and say, tell me more. What else do I need to know? What else? How else can we treat this? What are some other angles? So that's what I do for a doctor, standard medical doctor that says he has natural remedies or natural experience. It's limited. And then I go to a doctor, a chiropractor, kinesiologist who's very, very well versed on nutrition and all sorts of things, and basically the immune system. He's very well versed on the immune system. And really, when you look at it, you get a germ in your body, you get a virus, you get something. It's your immune system. It's the environment which causes the outcome. A lot of people are stuck on it, and I had this debate with my doctor friend. She says if you get a germ, you're going to get that disease. And I said, well, no, let me tell you a story. When I was 12 years old, I showed up positive for tuberculosis. You're not going to get the disease, you might get the antibodies to the disease. So I was exposed to tuberculosis. My neighbor had full-blown tuberculosis, which I didn't know at the time. I was exposed. I showed up, I had antibodies. He was exposed, he got it. So I said, here's two people, the same germ, tuberculosis. I didn't get it, he got it. I said, for the germ theory to be effective, for you to say that the germ theory works. There's only a theory right now, this germ theory. I know some of you are going to laugh at that and turn this video off at this point. But when you look at it, here's where you don't want to turn it off. When you look at it, if the germ theory was correct, if Louis Pasteur was correct in his initial theory, the germ theory, if we're all exposed to the same germ, we're all going to get the same outcome. That's not the case. If we're all exposed to the same germ, I had antibodies and my neighbor had full-blown tuberculosis. Same germ, two different outcomes. That right there blows the whole theory out of the water, because for that germ theory to be effective, it has to be an absolute. It has to be 100% of the time. So what did I do different than my friend? What did the people who didn't die from the bubonic plague do different? What did, the people that got swine flu, contracted it, versus the people that only were carriers? What was different in all of that? The difference is the environment. It's your body. It's your environment. You can inject me with the same stuff that you're going to inject my neighbor with, the same exact stuff, but my environment may be a lot stronger. My immune system may be totally different than his immune system. So at that point, I'm not going to get the disease. So what's the real cause of disease? The real cause of disease, is it the germ or is it your environment? Okay? Most doctors don't understand the concept of it's your environment that's causing the diseases. It's your environment. It's like the rats. Do the rats bring the garbage, or the rats show up after the garbage is there? Okay? Germs will show up and work their way in and be able to thrive where there's a positive environment for the germs, which means it's a negative environment for you. It's a negative immune system. It's not a proper immune system. Your immune system is not working well. So that right there blows the germ theory out of the water. Total germ theory at that point it doesn't even exist. But the whole way doctors treat you is based upon the germ theory. You tested positive for this, you have to have this drug. And they don't even treat you as a whole, they treat you with medications. I want to know how this happened to begin with. I don't know how I came up with a chronic disease. I want to know the answers. I want to know the causes. And if I know the cause, I'm not going to do it again. So if you know the cause of cancer, in one of my previous videos I said pollution. Pollution may be the cause of cancer. A lot of doctors say pollution is what cancer thrives on, what cancer feeds, which causes cancer. A lot of well-known doctors say this. So if you stop the pollution, you can stop the cancer. In fact, some doctors say cancer is the easiest thing to look at and cure and work with because it's simply pollution. But when you go to a regular doctor, diet and lifestyle to them means nothing. A friend of mine the other day, she was like, Marcus, my husband, I need a good alternative doctor. I spoke to the oncologist. He has cancer. I spoke to the oncologist about nutrition and diet. And he laughed at me and said, there's no relevance of what you put in your mouth and put in your body for the cancer. There's no relevance whatsoever. And she goes, I know that's not true. But here's a guy who's dead set in this way. He's 100% dead set that what we do is not going to make any difference. And that couldn't be the furthest thing from the truth. It couldn't be. So it's a shame. So that's what I do for a doctor. I get second opinions, third opinions, but here's the biggest thing. To get a different opinion. A lot of people say, oh, you should go get a second opinion. Second opinions are worthless. You want a different opinion. You want somebody who's going to tell you something different. Because you can go to 5 doctors, and if they all say the same thing, what's the difference? 5 doctors, same thing. You want to find that 6th doctor, that 10th doctor that's going to tell you, no, here's what it is, here's how you treat it, here's how you look at it, and then say, okay, here are my 2 options, A and B, not A, and A, that must be what I have. There's always a doctor that's going to give you a second opinion. I guarantee you, there will always, you have to look hard enough.